Okay, so since it's noon, let me officially start. And first of all, let me thank you all for joining us, and a special thanks to our partners who are co-hosting this event with us. In particular, the governments of Nigeria, Costa Rica, and Liberia, as well as the Office of the High Commissioner for Human Rights, UNICEF, WaterAid, CIMAVI, WIN, and SWA. I would also like to express my thanks to OHEHR and welcome the Assistant Secretary General on Human Rights, Ms. Ilse Brands-Keris, for being with us today. Some quick housekeeping notes. Number one, interpretation is being provided for this meeting in English, Spanish, and French. Tenemos interpretación en inglés, español y francés. Nous avons de l'interprétation en anglais, espagnol et français.
Interpretation into English,
Please
Spanish,
select
and French.
the language. Maybe I'm making a mistake now that I think of it. I should have chosen English. Okay, now I'm choosing English as my language. Sorry. So please select the language of your choice by clicking on the language icon in the bottom of the screen on the right-hand side. And that this is the language that you will be speaking in. That's important, and that's a mistake I was making just before. So please make sure that you mute original audio, obviously, when you are not speaking. For participants, please kindly use the chat box for any questions or comments, and we will address them during the time for questions and answers. As you might have guessed, we will be having two panel discussions with time for Q&A after each panel. The agenda of the meeting is now being displayed on the screen. Thank you so much. And now I would like to kickstart this event and just say before we start that accountability is at the heart of our work at SWA, at the heart of the work that our partners do. And accountability has a special place in human rights law, obviously, and in the SWA framework that has taken lots of inspiration from human rights law. It's our bread and butter. Our work in countries and at the global level is built around a framework or a mechanism for mutual accountability, the mutual accountability mechanism, as you call it. So you can see why we consider the HLPF a crucial forum that builds on the many layers of accountability for achieving the SDGs, and particularly SDG 6. So we have the HLPF, we have very humbly our mutual accountability mechanism. There are many other accountability mechanisms in the world, thank goodness. Yesterday, I attended another event at the HLPF, convened by the Office of the High Commissioner for Human Rights, with the current UN Special Rapporteur on the rights to water and sanitation, and me in my former capacity as rapporteur, where I learned from the representative of OHEHR that among the 53,000 recommendations that have been addressed to states in the context of the Universal Periodic Review, which is another accountability mechanism that exists at the global level, only 1% of the recommendations dealt with water and sanitation, which shows the need for greater and better accountability on water, sanitation, and hygiene, and of course on issues of inequalities, which still present the bulk of our challenges when it comes to realizing the rights to water and sanitation for all. So I will stop here, welcome you all to this event, and without further introductions, I'm very happy and pleased and proud to give the floor to Ms. Ilse Brands-Keris, the Assistant Secretary General on Human Rights. Ms. Brands-Keris has recently started her mandate approximately 6 months ago as ASG in New York City, and combines extensive expertise in political science, conflict prevention, and human rights, with a specialization in minority rights and long-standing experience in intergovernmental fora and with civil society organizations. She will address you and give some opening remarks focusing on accountability at the global level for SDG 6 during the COVID-19 response and beyond. Madam ASG, you have the floor, please.
Thank you, Madam Chair, Excellencies and dear colleagues. It's a real pleasure and privilege to be here with you in this important event to examine the critical questions on accountability. We heard the introductions for eliminating inequality in water and sanitation, especially during the COVID-19 crisis, but also beyond. At the outset, I'd like to recall this year's marks the 10th anniversary of the formal recognition of the human rights to water and sanitation by the UN General Assembly in 2010, after 3 decades of extensive discussions among stakeholders. I'm very grateful to the Sanitation and Water for All and all other partners which have joined the global campaign on the 10th anniversary, led by Special Rapporteur on the Human Rights to Safe Drinking Water and Sanitation, Mr. Leo Heller. The increased recognition of the importance of water and sanitation as fundamental human rights has contributed to progress seen over the last decade. Since 2000, billions of people have gained access to basic water and sanitation services. Maternal mortality in sub-Saharan Africa has fallen by 37%, and mortality in children under 5 years old has halved. The 2030 Agenda elevated water and sanitation as a standalone goal in the SDG framework, and specifically reaffirmed commitments to the human right to safe drinking water and sanitation. But despite this progress, we're still not on track for 2030. Urgent action is needed to accelerate the progress in reaching SDG 6. With only 10 years left for the implementation of the 2030 Agenda, SDG 6 remains one of the goals lagging furthest behind. And today, the pandemic is posing a serious threat to 2.1 billion people who are currently without access to safe water and unable to regularly and safely wash their hands to protect from the virus. The rights to water and sanitation are now a matter of life and death for 1 billion people who live in overcrowded informal settlements and slums worldwide. The 3 billion people in the world, including nearly 3/4 of people in the least developed countries, do not have a hand washing facility with water and soap at home, the first line of defense against the virus. Tragically, the COVID-19 pandemic is posing grave risks of reversing the progress made and exposing the weakness of economic and social infrastructure and governance and accountability mechanisms that have resulted in growing inequalities between and within countries. Last month, High Commissioner joined the Sanitation and Water for All's world leaders' call to action to achieve universal access to water and sanitation for all without discrimination. More than 80 heads of states and UN agencies, civil society and academic leaders have rallied to this call. The COVID-19 pandemic has brought to the fore that the existing inequalities in access to water and sanitation heighten the risk for infection and deaths from the pandemic. Limited access to water and poor sanitation can lead to a vicious cycle of increased risks of infection, serious health outcomes, and poor living conditions. In building back better together, we need to tackle the widespread inequalities and entrenched structural discrimination that have made some people more vulnerable both to the pandemic itself and to its larger economic and social impact. As the commitment to leaving no one behind goes beyond immediate responses to the pandemic, we need to address the systemic weakness and underinvestment in the water and sanitation sector, as well as in education, health, and other relevant areas. Critically, as recognized in the agenda of this important event and just reminded by our chairperson, we need to address the question of accountability. It's a cornerstone of the human rights framework and a litmus test for the human rights-based implementation of the 2030 Agenda. The human rights framework defines who is responsible for what and towards whom, and clarifies the nature of states' obligations, including taking steps to the maximum of their available resources to achieve progressively the full realization of economic, social, and cultural rights. It also involves obligations of an immediate nature, notably to remove discriminatory laws, policies, and other measures, and to assure minimum essential levels of each of the rights to assist those less furthest behind. The human rights framework also establishes the conditions to hold duty bearers answerable to rights holders for their decisions and omissions, and provides mechanisms through which people can fulfill their rights, monitor progress transparently, sanction poor performance, and seek redress for human rights violations. In sum, water and sanitation are basic human rights, not mere commodities that can be bargained or traded off. In the context of COVID-19, the human rights obligations would require states to identify who are impacted the most from the pandemic, collecting and using disaggregated data to identify priorities, disparities in and barriers to access to water and sanitation, healthcare, social protection, and other economic, social, and cultural rights. Second, analyzing patterns of discrimination, underserved areas, and identifying populations or groups facing persistent discrimination and marginalization. Third, developing a fully costed strategy and plan of action addressing the minimum core obligations applicable to the rights to health, social security, water, housing, and education, as well as key gaps identified in the above assessment. Fourth, ensuring the meaningful participation of all stakeholders in the planning process and beyond at national and subnational levels, with specific measures to secure the inclusion of marginalized groups and populations. And fifth, making available effective avenues for seeking remedies in case of rights violations. The human rights framework makes it clear that states have the primary responsibility for the realization of human rights, but all stakeholders, including the private sector, have a share in these responsibilities to ensure respect for human rights. However, the diversity of actors with key roles in the water and sanitation sector implies that the traditional state-centered accountability framework may leave some gaps. Globalization and the neoliberal economic policies have often weakened the role of the state in the provision and regulation of water and sanitation services. The widespread presence of informal and unregulated service providers that operate without a license or outside of any form of accountability. The fact is, many poor people in informal settlements have no choice but to pay more for water of lesser quality than those from these informal vendors, while wealthier people living in areas with piped connections can enjoy access to cheaper and quality water at home. In the context of a crisis such as COVID-19, the absence of a clear accountability framework based on human rights standards and guidance, combined with the urgency of the situation in which actors operate, can create a gap where no one is held accountable for people's lack of water and sanitation. The UN human rights mechanisms provide an accountability framework at international level, as well as a wealth of guidance, information, and data that can help identify groups already behind and those at most at risk at being left even further behind. As our chair said in the introduction, among the 53,000 recommendations related to the SDGs under the Universal Periodic Review, only 1%, 390 recommendations, are related to SDG 6. That represents a largely untapped potential to be exploited in the strengthening the synergy between the human rights mechanisms and the governance and accountability mechanisms for water and sanitation at both national, regional, and global levels. Earlier this year, the Secretary General announced his call to action for human rights. Among its central tenets is that human rights should be at the center of sustainable development. The call to action appeals to all countries to put human rights principles and mechanisms front and center in the implementation of the Sustainable Development Goals, including by creating wide avenues for civil society participation. We can only deliver the SDG 6 and the human rights to water and sanitation through coordinated efforts among all stakeholders in all relevant sectors. Safe water and sanitation are not just guarantors of good health. They are gateways to multiple other rights: nutrition, food security, livelihoods, education, shelter, peace, and stability. Our office is working with authorities, affected communities, and civil society in various locations to promote the realization of these essential human rights. This includes, for example, a joint monitoring effort together with local social justice centers of the human rights impact of COVID-19 in informal settlements around Nairobi. In a very hands-on manner, this project helped the communities to express their priorities and participate in shaping the implementation of SDG 6. Placing human rights at the center of our response is key to building more inclusive, more resilient, and sustainable world after the pandemic. Our office, together with our UN colleagues and partners, is committed to supporting your efforts to make the human rights to water and sanitation a reality for all. I thank you very much.
Thank you so much, Madam, for your intervention and for bringing the human rights framework to the discussions to set the scene before our other speakers start intervening. And I hope that what you said in terms of the obligations that states have, and we have representatives from governments speaking here today, but also the responsibilities, as you mentioned, from the private sector, but also from other stakeholders, also the responsibility to come together and work in a multi-stakeholder fashion. I think it was important again to set the scene. Also drawing the fact, having mentioned the work that not only the office has been undertaking, but also the human rights mechanisms. And we could also draw everyone's attention to a statement issued by the Committee on Economic, Social and Cultural Rights on economic, social and cultural rights at the time of the pandemic, which brings us back along to many of the ideas that you referred to, that we need to start, that there are immediate obligations that states have. They are not only of progressive realization, and that retrogression, meaning backward steps in the realization of the rights, are still seen in principle as violations of the rights. So thank you so much for your inspiring words. And let me just start the panel number one, which will talk about, where we will discuss challenges, certain challenges at the national level. So we have here with us Miss Yamilet Astorga Espeleta. Maybe I change into
Ms. Yamilet Astorga is the president of the Institute of Aqueducts and Sanitation of Costa Rica, with broad experience in the field of water researches for about 28 years. Ms. Astorga has also worked as a scholar and research at public universities for many years. She has also held prestigious positions both as a national and international consultant for different organizations, such as the State of the Nation of Costa Rica, the Ministry of the Environment, as well as for the European Union, the World Bank, and the
our next speaker,
Inter-American Development Bank.
Okay, our next speaker is Ambassador Bobby Whitfield, who is the chairman and CEO of the National, the Liberian Water, Sanitation and Hygiene Commission. He has worked as a community development coordinator at the Brisbane City Council, senior community development in Queensland, Australia, before he moved back 3 years ago to Liberia to contribute to and actively participate in the country's development process. He has served in several community leadership roles, and he holds a master's degree on development practice, again from an Australian university, and he was appointed 2 years ago by His Excellency President George Weah as Liberia's first WASH Commissioner, Chairman and CEO. Then we also have my old friend, Robert Gakubia, who is the Kenyan regulator for water services, the CEO of the Water Services Regulatory Board in Kenya. He's a professional engineer, registered by the Engineers Board of Kenya, and he has been working in the sector for the last 35 years. And at last but not least, we have Miss Kellyanne Naylor, who has over 19 years of experience in the water and sanitation sector, managing urban but also peri-urban and rural water, sanitation and hygiene programs in different parts of the world. Prior to joining UNICEF, she started her career working in Nicaragua with Agua para la Vida, a local NGO, and in the US with private engineering firms developing water and sanitation infrastructure master plans for cities and small towns. Okay. Having introduced you our marvelous panel, let me immediately jump into the questions. I will start with the two government representatives, first of Liberia and Costa Rica. Can both of you, and I will, we will need to be strict with the time, Ambassador Whitfield and Doña Yamilet, can you tell us how you have resources, how have resources been allocated for WASH COVID-19 relief, how they were used, and how is that being monitored and regulated in your country? So have there been money allocated, how it has been used, and how have you managed to monitor the way in which it has been used? Maybe I start with you, Ambassador Whitfield.
Thank you very much, Katarina, and good afternoon from my end here in Liberia. Thanks for that nice introduction, and it's great. I mean, 3 questions in one, so I'm very conscious of the time. I want to start first of all with issue of accountability. Can you hear me? I hope I'm laudable. I'm clear enough. Good. Awesome. Awesome. So I want to start with the issue of accountability. When I came to the role of WASH Commissioner, the very first WASH Commissioner of the Republic of Liberia, I sat and I did a lot of, review and decks, studies and what have you of the WASH sector. And what I saw was really, really frightening. A latest report just validates that, the latest GMP report put Liberia at the bottom rack, globally, Liberia, 1% of this population having access to hand washing. And then I asked myself, during the time of Ebola, were the people not washing their hands in Liberia? Indeed, they were washing their hands. But what happened to all of the facilities? Were the facilities provided? Who responsible? So further research will tell you clearly there have been lack of accountability. And because of lack of accountability, our people are now suffering. They don't have access to hand washing facilities. They don't have access to 100% basic access to safe drinking water. They don't have 100% basic access yet to decent toilet facilities. So I have set myself the task that for this WASH sector under my leadership, transparency, accountability will be my #1, will be very high on my agenda. So I work very closely with our partners and ensure that we respect that what comes to this country in terms of addressing the issues we are faced with in WASH is addressed. So going to the main question for the day is how resources are allocated for WASH, COVID-19, related response. What we've got in Liberia is a system set up internationally known as the Incident Management System. So the Incident Management System has been activated by His Excellency President George Marovia back in January of this year. So once that system was set up, the system is further, subdivided into pillars. And the pillars are the ones that drive the response effort. So within that pillar, you've got a WASH pillar. It is at the IMS, the Incident Management System, the donor partners come and contribute to Liberia's fight against COVID-19. And each pillar puts in a summation to the Incident Management System for activities in terms of addressing, COVID-19. The WASH pillar, for example, we put in summation of about $3 million. And the $3 million, even though we have not gotten everything yet, but at least what have come into the WASH pillar, we have been able to secure, or not just temporary, but permanent hand washing structures across the country. We have also been able to secure, or provide soap. Soap is very important in the fight against this. And those things are monitored by civil society and other government partners. What we got under the WASH pillar is actually made of, a number of government line ministries and agencies, and as well as development partners and the civil society. So there is clear, check and balance mechanism built into that. The WASH pillar meet very regularly, and we discuss funding that have been allocated and how to disperse the funding. Another area you also talk about is how it's being used. It's being used for the internal purpose. And every 2 weeks, the WASH pillar gave back reports to the IMS. And that report is already discussed in the pillar meeting. As a pillar meeting, we come and discuss the report before myself as a pillar lead present that report to the IMS. With that, you ensure the highest level of transparency and accountability, and most importantly, those who are in the most need are going to be impacted positively because of the intervention.
Thank you so much, Ambassador Whitfield.
Thank you.
Thank you. I'm sorry, I don't mean to cut you off, but I think that your information was very interesting. I was already aware of it because we had talked about it. So thank you so much. Maybe you stay with us, and then if there are questions, then I will give you again the...
Awesome.
Ms. Yamilet, the same question for you.
Muchísimas gracias.
About resource allocation.
Muchísimas gracias. Un saludo especial a Catarina, a Ilse, al señor embajador. De verdad, un agradecimiento por la participación. Bueno, en Costa Rica primero ha habido un liderazgo muy fuerte del sector salud, principalmente del ministro de Salud y del señor presidente, así como del presidente de la Caja Costarricense del Seguro Social, dado que el sistema de salud de Costa Rica es un sistema integrado de todos los hospitales y de todos los centros de salud, como también del presidente de la Comisión Nacional de Emergencias. ¿Sí?
Emergencies Commission President. I have to interrupt because you once again have to press the button. The Spanish button. Remember last time I had the same issue? Well, in the lower right-hand corner of the screen, you will see interpretation.
Ay, mi Dios, qué tirada esto.
And you have to go to Spanish.
No.
Can you see it?
Es que tengo la pantalla pequeña.
No, because I'm using a small screen.
Voy a pedir.
Look, Yamilet. Do you mind?
Sí, mejor. Y yo totalmente de acuerdo. Hagamos eso mientras yo corrijo esto. Gracias. Perdón.
Okay. So, because Ms. Yamilet Astorga has a problem with the interpretation channels, I am now making a little bit of a surprise to Robert Gacubia and asking him a different question, if you don't mind, Robert. WASREP is making particular efforts to regulate beyond formal services in urban areas, to include rural areas and also informal informal settlements. And we heard the Assistant Secretary General talk about the importance of putting the furthest behind first, bringing them on board, and also knowing who is being left behind. So I think that the step that WASREB has given in also regulating informal settlements is very welcome. So can you tell us how important that has been for reaching unserved populations during this pandemic? And Robert, I'm also only giving you 3 minutes.
Thank you very much, Katarina, and hello, everyone. I want really to say that for us in Kenya, in the water sector, accountability has been a major guiding principle in terms of what we are doing. And based on that, guided by that, we have been trying to formalize service provision in all the areas. We have already a good baseline in terms of formal service providers who are accountable to services in the urban areas. We have now gone into the rural areas that were basically been left behind, and especially also low-income areas within the urban centers who are also left behind. And we have actually developed regulatory guidelines to actually show the providers and the local governments how they can actually address the issues in the rural areas. For us, when you do not have formalized water service provision, to us it is a form of discrimination. And non-discrimination is a guiding principle also in terms of how we are addressing the water service provision in these areas. Accountability starts with clear roles and responsibilities. So when you do not have a responsible entity, then the roles and responsibilities will be blurred. And in a situation like we have now, where we have this pandemic, we find, of course, the government are very quick to act. But immediately after that, the services that are provided seem to be left alone. That is, there is no one responsible. So we are demanding that these kind of plans should be put in place, and the water service provider should be responsible for that, because then we will be going forward. We will be trying to work on resilience and building long-term plans. We do not have to be reactive in terms of addressing these kind of emergencies. Public health emergencies are always coming up, so we should be able to know as a responsible entity, how then do we address them? And do we, for example, within the first week, we are already crying that we are collapsing? I do not think that is the issue. So in our situation, we are demanding a plan and a strategy as to how to address these areas. And these areas have already been identified. We have 8 million people in this country in the low income areas. We have a bigger number in the rural areas. And these are areas which we should not be left behind in line with the SDGs. So all the guidelines are set. And basically what we'll be doing is making sure that the local governments are implementing this, of course, with the support of the national government and the regulator to be in the front line in terms of monitoring for accountability. Because at the end of the day, accountability has to be put in place. Otherwise, without really accountability, we will be doing work at suboptimal level. So basically, that is what we have been doing. And I really want to say that when it comes to informal settlements, in terms of addressing their problems, this pandemic has actually given us a very, very good lesson in terms of which people have been left behind and how we should address and not allow these inequalities to continue. Thank you very much, Katalin.
Thank you so much. I hear you speaking, and I remember when we met over 10 years ago in Nairobi, and when I saw firsthand the excellent and groundbreaking work that you are doing, also in informal settlements and remote rural areas. So thank you so much for what you said and for having referred to the fact that we need to get things right already in times of normalcy, so that we are prepared for this and other pandemics and disasters and crises, because as you said, they will be coming again, and accountability is indeed key. Thank you.
Are you ready already? Yes, I am ready. Great. Thank you, and my apologies. So I was telling you that in Costa Rica, first and foremost, well, we have the president and the minister of health, the health department, and the emergency commission is also highly involved. We have passed a process in our Congress. So first of all, to just face this COVID situation, specifically in terms of supply. Let's talk about AIA, which is the main supplier, and also the common aqueducts that we have. We have been discussing what has been the impact of this. On the one hand, we're talking about finance and also the impact of this. First and foremost, what is the amount of water or quantity of water that has been carried over? Because right now we know that we are in a time where we have had a very, very difficult drought time. And well, we know that water is key for us to continue with our hand washing protocols. So there are many, many reasons why we have to have trucks and tanks. And well, these storage tanks have not been only paid by the ministry for various communities, including informal settlements, for instance, but also this emergency commission at a national level. They both have just really covered all of these expenses. So this is for us to be able to reach and cover the country as a whole. To do this, we have had some requests for us to be able to place water tanks and to have our tank cars just carrying this water over all of these places, very remote and rural areas. And we have been able to provide them with permanent assistance in this regard. So this is something that we have already accounted for as part of the budget that we have passed by our Congress. We know that this is a budget that has been handled by this National Emergency Commission that I was telling you about. In this commission, we have the participation of various institutions and instrumentalities of the state at several levels. We have a political level, a technical level, and municipal emergency committees. So these needs come from the bottom up. These needs are established and filed by these municipal committees, where we have the participation of the Ministry of Health, Ministry of Environment, the IAIA, as I was telling you, which is the Aqueduct Institute in Costa Rica. We have other development entities specifically for the community, and common aqueduct institutions as well. Well, what we do there is that we just bring all of these needs to the table just for us to be able to see what areas are not getting this water supply. Then we would start just filing some water requests. In these requests, we would just state the need and the cost of it. So then we would take this filing to a political and ministerial level. We have to keep a record of the expenses of this water being carried out in the transfer of this water and what is the financial impact. This National Emergency Commission, like I have told you, has started a program with a series of projects where several projects that are directly related to the pandemic are going to be carried out because of this water supply process. We need to find the link between these parts. If we are to just immediately address these issues, then the consequence is that we are going to have water carried over to all of these sectors, to our whole population. Specifically, well, we're talking about drinking water. That is very important to note. We need to make sure that water doesn't have these some sort of traces of chloride or contaminants, and the water that is taken to these communities that do not have an aqueduct is going to be drinking water, like I told you. We have a standard by the Ministry of Health in terms of these storage tanks and the requirements of this water pipes as well, in water tanks. And well, as part of all of these projects, we are not to immediately address this, but by means of a series of development projects to just increase resiliency facing this crisis, and that resiliency is going to be part of this aqueduct project that we will have in those communities where we do not have this access. It is important to note that in Costa Rica, we have a high degree of immigration, and well, we have a lot of people coming from Nicaragua and other surrounding countries. So our country has not only controlled our border, but also we have established certain camp stations or camp areas where they require water supply. So IAI needs to supply water to these camps with water. So with these informal settlements, we also need to supply water publicly and make sure that this public source of water is as close as 500 meters. So all of these costs are being just measured and quantified, and as part of the government actions, they require us to start just quantifying all of these operations. And we as operators, we follow a decree issued by the president where we are informed of the fact that we cannot just stop the water supply because of delinquent accounts or delinquent bills. If someone is not paying their water bills, that is not going to result in any sort of water suspension service or anything at all. Of course, that is going to have an impact on us as an institution. And we are now reaching a 13% of impact. We have some other common operators. My apologies, Jamilet. We are running out of time. My apologies. Thank you so much, Jamilet. So let's just move forward, all right? We have a lot of questions. We're getting a lot of questions in the chat right now, and you're going to have the chance later on for you to be able to answer to all of these questions according to what you are just sharing with us. All right?
Okay. So let me now quickly move to Kelly, who is here representing UNICEF. UNICEF has undergone a big effort trying to document initiatives by governments to face the COVID crisis and aspects of inclusion with those responses. How would you describe levels of transparency and availability of information? And how do you think this information, including any progress or regression in availability of services and their levels, will be captured by monitoring mechanisms like the joint monitoring program? The other day, you told me something, I was going to say that I never forget, but now I forgot the expression, that you said that that we will see the impact that COVID has been having on access to water and sanitation, that it can improve, but that we also can go backwards for some of the reasons that some of the colleagues here today, Yamilet, mentioned. There are challenges that utilities are facing, and they are facing greater challenges in keeping up the services. On the other hand, governments are paying more attention. So what have you been seeing, and how will this be captured by the JMP? Over.
Great, Katerina, thanks so much, and greetings, Excellency colleagues. And it's just always such a pleasure to be connected here with the SWA friends. So thanks so much for having me. I think, of course, I mean, all of us know that COVID is a unique crisis and challenge for our sector. And I think both through the number of countries that have been affected, but also the dimensions of the socioeconomic impact that we are witnessing. And UNICEF's response so far, we've been responding to the COVID-19 response in 125 countries. And this response is really based around, first, the public health response, where we're trying to reduce the transmission and, of course, reduce the mortality from the virus. But secondly, is also very much around the continuity of essential basic social services. And we've been really kind of looking, as Katerina said, at assessing and responding to these impacts, and part of that is really around monitoring. So I think this will be able to feed into our conversation. So first, on the issue of transparency and availability of information. So I think first and foremost, and I think we heard this also from Ambassador Whitmore and others, that transparency is of course essential to the work that we do as an agency, and especially when we look at data standards and transparency in our own organization. question. We really benchmark ourselves with the 2028 Transparency Report, where UNICEF has come out now as the 6th out of 47 major development organizations. So I think, you know, we need to hold ourselves to account on these issues. So 2 points really, Katerina, to respond to your question. I think first, in terms of looking at what are the actions that are being taken under the framework of the COVID response, whether it's under the Strategic Preparedness and Response Plan that's being led by WHO or under the Global Humanitarian Response Framework, we are seeing that countries are collecting and reporting on data in terms of how this response has been undertaken, and that, you know, the information has generally been able to provide a picture of what is happening on the ground. And for UNICEF, this comes primarily through our country offices and also are then reported in what we call our UNICEF situation report indicators that we're able to report every 2 weeks. But what I would say remains a real challenge in terms of data collection, particularly on the response, is the level of granularity in that information. And I think really very pertinent for this question on inequalities is that it's been very challenging to collect disaggregated data. And for example, for UNICEF, only in our last situation report, only 32 countries out of a total of 106 that were reporting WASH results were able to disaggregate their results by gender, and only 11 countries were able to report on the number of people with disabilities that had been reached. So I think despite what our own ambitions on being able to collect disaggregated data, this is obviously compounded by some of the impacts of the response to COVID, which of course would prevent the ground verification of results. And that is largely due to travel restrictions, to restrictions on contact between, you know, moving around to be able to collect the data. The second point, so that's really more on the public health emergency, but when we look at the impact of the socioeconomic crisis and the socioeconomic situation on countries, and really looking at how can we capture information on the continuity of WASH services, we're facing the same kinds of challenges, that restrictions on travel and access to be able to undertake statistically significant surveys is very challenging. We made an attempt across 65 countries to collect data on the level of disruption of certain WASH services. And while we did get results, they were largely qualitative and anecdotal, and were not based on you know, specific surveys that were able to be undertaken systematically with all water providers, operators, that we would be able to do if we were doing this type of work in a non-emergency setting. One promising initiative that we have is a partnership that's ongoing with SWA, the Stockholm International Water Institute, where we've tried to look at using other data sources, and in this case looking at utilizing third-party information, such as information from water utility websites, news articles, and really looking at how we can then triangulate this information with countries and partners to be able to provide a complete picture. On the second part of the question, Katerina, and kind of, I wish I had a crystal ball to look into to be able to really tell you, is COVID going to make WASH services go up, or is it going to set them back, or are we going to find hand hygiene improving for the long term? I don't have that crystal ball yet, but what I do want to talk about is a little bit of what might be some of the impacts on our ability to monitor the SDGs through the Joint Monitoring Program, which is of course co-led by UNICEF and WHO. I think the first thing that we can say is to look at how COVID can represent an opportunity. And I think this is first in a really increased demand for data, particularly on hygiene. And you know, we know that hygiene was omitted from the MDGs. There was a tough fight that we had as a sector to get hand washing included in the SDGs. SDG indicators. And of course, now we have a real opportunity to harness this renewed interest to create more robust national systems for monitoring hygiene, particularly in institutions such as healthcare facilities and schools where data availability and data quality remain poor. But on the challenges side, we are facing a COVID-related data crisis. And, you know, statistics offices are also closed. And I think our data is showing that approximately 80% of national statistics offices are closed. And this is going to have a big impact on the routine data collection exercises, whether they're censuses, whether they're household surveys that have been placed on hold and will not be collecting that new data sets that can be used for really updating the methodology and the process of being able to get those new data updates for the next JMP reports. And so this could also have an impact, as we said, around the ability to look at inequalities in wash services before, during, and after the pandemic. And you know, I think a lot of us have noted that the crisis itself has very much highlighted the immense social inequalities of where the hotspots are turning up in areas with poor housing conditions, with crowded spaces, and with poor access to water and sanitation. Just to close, so JMP is just going to be adapting to be looking at more data, investing in more remote data collection, and we'll really need to work together as sector partners to be able to look at how we can address these data gaps. Thanks so much.
Thank you so much, Kelly. Thank you also. Thank you. Thank you for the information. You don't have a crystal ball. What a pity. But good that but the information that you gave us already enables us to understand a little bit of the challenges that you are facing. And honestly, you never think of all the knock-on effects, the implications that the COVID crisis can have. And I had never thought that 80% of the national statistical offices were shut down. And at the moment, at the time when, as you were saying, we want more data on hygiene, but because we know that hygiene does not appear from a vacuum, this is also related to the amount of, or the availability of water. And what you're saying is it's more difficult to get the data. When we heard the previous speaker say, and you also, about the importance of us having the data if we want to control this pandemic and other pandemics. And if we take the words of the UN Secretary General seriously when he said that our health depends on the health of the most vulnerable members of community. And as the Assistant Secretary General was saying, one of the first steps is to know who are they and where are they. So we are our hands seem a bit more tight than they were last year. Okay, so I want to ask 3 questions, and we have 3 minutes basically to end this panel. So I'll ask them in chronological order. Question 1 from Dedo at WaterAid for Robert. And Dedo is asking, what are the long-term plans for poor access to water and sanitation, and what are the accountability mechanisms in Kenya? 1 minute, Robert.
Very much, and I believe I have even answered it on the chat box, so I really don't have to really take even that 1 minute, unless of course the answer is not satisfactory. I've already answered it on the chat box.
Oh, you did? I'm sorry,
yes.
I didn't see it. And what was the answer, very quickly, so that everyone can hear?
What I'm saying is that every utility is supposed to prepare a plan for water access to these informal areas, those underserved areas. And that plan is a license requirement before we even issue it with a license. We monitor that plan in terms of its implementation, and depending on how they are doing it and where they are, we actually put it in our annual report, which I release every year. This year's report, I only released it on Monday, and we have ranked the water utilities in terms of how they have responded to service provision in the low-income areas.
Thank you so much, Robert. Very clear. We have another question from Temple Oraeki for Ambassador Bobby Whitfield. Are you still with us, Bobby?
I'm here, Katerina.
You are there. I thought you were going to escape my question. Good. So the question is, does Liberia have an independent monitoring agency for WASH interventions as it relates to WASH COVID response?
No, not for COVID response, but the mandate of the WASH Commission extends to the COVID response. So we have got the WASH Commission. The role of the WASH Commission is to serve as the regulator of the entire WASH sector. So the COVID response falls within the component of the COVID response that is WASH related is also going to be regulated by the WASH Commission, even though the Commission is leading a payload, but we also regulate the entire process.
Okay. Thank you so much, Bobby. And at last but not least, Kelly, again, Dedo from WaterAid, he's asking a question regarding data. I guess you saw it, that we need to revisit national data sets. We shut down the National Statistics Office. It's not easy, but okay, we need to revisit national data sets. And the disaggregation does not only to be by gender, but also by other grounds of discrimination. We all agree, and Kelly, you were referring to the challenges. Sorry, this is not me. So Kelly, she was referring to the challenges of data disaggregation at the national level. Is there anything else that you wanted to, that you would like to add, Kelly, regarding data and the challenges faced at national level?
Yeah, great. Thanks so much, Dedo. I really appreciate that question. I think it's the one we're all asking. I think where we need to challenge ourselves now is, and I always say this, that we can't change our context. The constraints that we have, we have to adapt ourselves to find the solutions. And so I think I mentioned this a little bit at the end of my intervention, but I think we have to push ourselves further to see how we can do the things we need to do, but with other methodologies. And I think we need to look at whether or not we could be doing WASH surveys by telephone. Could we be doing other types of remote access to be able to collect data? I think we do have to look at whether or not we would be able to do some rapid surveys, really focusing in areas where we already know that there's the greatest need to be able to reach out to the most vulnerable populations. If we don't have the resources to do them at national scale, could we focus them in some of these hotspot areas? So I think it's going to require all of us to be able to kind of adapt our methods, try to see where we can use technological innovations, and really target resources so that, again, making this critical link between, it's not data for the sake of data, but it's really data to be able to make WASH services more sustainable, more equitable, and really highlighting also the issue of affordability, which is something else that's coming up as especially income levels can be declining with this socioeconomic crisis. Thanks,
Thank
Katrina.
you so much, Kelly.
I have a last question for Mrs. Jamilet. Jamilet, there are a lot of persons who are talking about the significance of having data and who has access to these water and sanitation services or not. And you actually wanted to talk about something else that was related to this, meaning something that is related to the use of data on quality or gene material, specifically in wastewater, for us to be able to really identify what we call hotspots, specifically for COVID-19 purposes. Can you please address this? Yes, the National Water Laboratory by the IAA, I had mentioned already, has already developed a technique to be able to identify what has been the actual footprint of this SARS-CoV in wastewater. So we are just really trying to identify this footprint, or what have been the traces of this virus in this wastewater. So right now what we're doing is that we are really conducting this copies per milliliter. We're doing it by the milliliter. That's how we have been doing it. And we're trying to find the ratio of infected persons and this concentration for us to be able to develop this statistic. We're trying to develop this data for us to be able to really establish a good database as a baseline and to be able to find the actual ratio number of copies per milliliter of this SARS footprint and its relationship with the number of persons. We have been monitoring wastewaters from hospitals, healthcare centers, wastewater treatment plants, and of course we also have these numbers that have been provided by the Ministry of Health, and we have tried to match them for us to be able to find this ratio. This is ongoing investigation and research that we're trying to do with Latin America and Brazil, and we're doing it. And of course, in Europe, in other countries, we have also been working just really closely just across many countries for us to be able to do this. We already have got the results. We have had positive results, specifically where we have seen these infections and negatives in those areas where we have not seen this infection. So I believe that this is a good technique. It works, and this would be useful for decision makers specifically to be able to control this pandemic.
Thank you, Yamilet, for sharing the mechanism you're implementing in Costa Rica with us.
Let me thank all the participants in this first panel for your interventions, but also for the answers you gave to the questions asked. And let's now quickly move to panel 2. We are 5 minutes behind schedule, and it's my great pleasure to now hand over the floor to Ms. Valerie Traore, who is the founder and executive director of NIEL. As you can see, Valerie has over 19 years of professional experience in campaigning and advocacy on a wide range of issues, including human rights, rights-based programming, development, human security and conflict, politics, and international relations. Valerie, I hand it over to you.
Thank you so much, Katerina, for that. And thank you all of the panelists and the interventions earlier. And this is a great transition to this panel. I'm really, really excited that we will be discussing very clear and practical examples from all over the world globally with people that are working at the regional as well as a global level, and that span Africa, Latin America, Asia, and really have a lot of experience to share in this time, but also generally around water and sanitation. This panel is really looking at experiences of accountability, and the transition is great primarily because we've had the opportunity to see what government and state actors have been doing. And obviously, as we talk about accountability, it's also how do other actors hold government and also other actors accountable for some of those things. Great examples, great case studies that we've heard. Now we're gonna take a few steps back and look at some of the lessons we've learned across the board and the things that we could do better. And for this panel, I have the great pleasure to have 4 great people. Given the time that we have, I'm just going to bring them on one by one and introduce them as we go, just to make this transition smooth. So thank you all for sticking around, and really excited to have this panel. The first panelist and the first person I'm gonna ask a question to is Barbara Schreiner, who is the Executive Director of Water Integrity Network. And I'm going to start with you also because a lot of your work for the past 20 years around water and sanitation has also focused on good governance. And of course, we can't talk about accountability, as former panelists have said, without talking about good governance, obviously. So Barbara, what do you think were the main elements lacking in the COVID-19 response in terms of leaving people behind, those that were left behind, and how can we make sure that as we're continuing this fight and as we continue this battle, we hold those that need to be held accountable, indeed accountable? Over.
Thanks very much for that opening. And to try and be brief, because I know that we're short of time. I mean, I think one of the things is that the COVID crisis has really thrown into stark relief those people who are without access to water and sanitation. And there really have been attempts to actually meet the needs of those people. I think in doing that, one has to ask a number of questions. And the first question is really, are those responses sustainable in the long term? So a number of places have opted to put in tanks and tankering and emergency services of that nature, but precisely as Ambassador Whitfield mentioned about the Ebola responses, are those responses still going to be there and effective and sustainable once the COVID impetus has actually fallen away? So are they long-term sustainable? And really, we need to ensure in terms of accountability that there is an accountability towards putting in place sustainable services that will still be there for the poor and the marginalized in the long term. I think the other big intervention that we've seen is this thing around government saying people will not be disconnected and they don't have to pay their water bills. Again, there's a question about the long-term sustainability. That has had enormous impacts on water services providers and their financial sustainability, which hasn't necessarily been taken into account in the question in that policy position. And so how is that going to affect long-term the provision of water and sanitation to marginalized communities in particular? I think it's also interesting that in some places, for example, in Honduras, where they've seen some of the utilities have seen a reduction in their income because of that position of no disconnections and you don't have to pay your bills. One of the things that has fallen away is some of the transparency and participatory mechanisms that are in place, which means that we might find ourselves, as has been mentioned in the previous panel, we might find ourselves going backwards in terms of some of the implications around both services provision, but around the accountability mechanisms and the more community level participatory and accountability mechanisms that are in place. Just very briefly, and I know that I don't have much time, I wanted to talk about an accountability mechanism that is being put in place in South Africa through the International Budget Partnership, which I think addresses some of the interesting challenges that have been raised in the previous panel, where in fact, through using WhatsApp and SMSs, people in informal settlements are reporting bi-weekly, twice a week, on the status of water delivery, sanitation provision, and refuse removal. And that information, there are now 500 areas that are actually contributing to that. And it's really a bottom-up mechanism for looking at the COVID response. And it is and it is provided to government as a way of actually keeping them accountable for their response to COVID in informal settlements in particular.
Thank you so much, Barbara, for setting the scene for how some of those elements that are crucial. And I'm now going to come to Dedo. You talked about the sustainability of the response. You talked about the transparency, the participation, but also the financial sustainability of the people that have to pay for the services, but also of the utility companies that have to continue to thrive and to be able to provide a service. Dedo, I want to bring you in now. And Dedo, you are the Pan-Africa Program Manager at WaterAid, and in that capacity and through the 2 decades of time that you spend doing a lot of work around the continent, but even beyond that, on development, right now you cover multiple countries with WaterAid. Are these some of the similar lessons that you've seen in terms of what is important, but also what is missing in terms of accountability mechanisms to look at some of those key points that Barbara has raised? Or have you seen something else that are missing in terms of the responses that have been put in place? Are they inclusive from what you've seen?
Thank you very much, Valerie, for that question. And good afternoon, good evening to everybody else. I think the point that has been made earlier is very, very critical. And that, for all you all know that WaterAid is not a humanitarian agency. And that for the last 35 odd years, we've been working strongly in development. And so, we've had all the parameters for making things work. I want to really focus in on how we have responded to the COVID-19 crisis, in that, as a WASH organization, the elements for a quick response were there. We have strong relationships with communities, we have strong relationships with local governments, we have strong relationships with governments and the media. And so that has helped in fast tracking any of the responses that WaterAid has put in place. I think Kelly talked earlier on about, targeting, and I want to say here that, because of the partnerships that we have worked in, we have been able to, in a number of places, not go on the field ourselves, but via communications, work strongly with partners. So for example, in Cambodia, where we're working with the bricklayers and construction workers, it was very clear that the lockdown or the COVID-19 pandemic would have great impact on the economic and social lives of the brick workers. In Zambia, we have actually gone ahead and done further vulnerability studies in a very, very densely populated peri-urban settlement and have used the youth to augment the messaging. We have also used, because of the densely populated nature of that place, we have gone ahead and used innovative means to reach out to the community using drones for messaging. Our relationship with private sector has enabled us to quickly build innovative hand washing facilities and been able to use that quickly in the field as well. And of course, our relationship with government has enabled government to approach us as WaterAid to go ahead and put in a lot of the things that we have been able to do. I think you're all aware of the permanent hand washing facilities that we've put in place in Rwanda via the government's request. And then of course, in terms of the remote communities that we were working, I think the Ghana example shows that working with our civil society partners and the media, we've been able to translate the COVID messages into languages, into dialects that under normal circumstances would not necessarily feature in the news and the radio. Back to you, Valerie.
Let me stay with you, Dido, for just another 30 seconds here, because you've talked a lot about what WaterAid is doing, and you started by saying the relationship that you have with government has enabled that. One of the things that came up in the chat earlier was talking about the collaboration between civil society organizations across the board, and not all civil society have that kind of relationship with government to be able to hold the government accountable beyond being made accessible to be able to deliver on their projects. Is there one thing that you have seen has worked in widening the space for accountability in one country? Can you give me one example? I know it's short of time, but in like 30 seconds or a minute, that has been a good way to see how civil society at large has been able to engage effectively and hold the government accountable, not just in terms of delivering of services, but really hold the government accountable during this time.
You've got asked a very important question, Valerie, and I want to say that, under COVID, we don't have any specific accountability mechanisms, but WaterAid has been working with a number of countries where they have been reporting on the voluntary national reviews. And so, example, Mali, where, when they were reporting last year or the year before, our teams went out into the field, worked very, very closely with civil society to go out and collect data, with which now they use to juxtaposition against the information that the government has. In Ghana as well, we have the SDG platforms that the Ghana Country Program is helping to establish at the district level. So it's not just for WASH, but it's looking at the commitments that government has made under the Sustainable Development Goals and working with these civil society organizations to see how implementation is happening in the field. Implementation via their own programming and implementation by government, and then supporting the data gathering for the review. Thank you.
Thank you so much for that. And I'll go straight and move into to talk to you, Zubair Hassan, who is of DORP in Bangladesh, but also here today to speak to us on behalf of Simavi. And Zubair, you have, again, like everybody on this panel, so much experience in Bangladesh in the field of water, in the field of sanitation and health. And so we have so much to learn from your experience. And one of the things that you have been doing in this particular time, but also before that, is working with budgets and using budgets to track and use and hold the state accountable. Can you speak to us of that a little bit? And what have you learned? Has that been useful? Has that been challenging? And what are the specific lessons that you can draw from that?
Thank you very much. Thank you, the honorable moderator and the participants from across the globe. I think this is the right time to answer this issue because we are passing a very challenging situation with COVID, and that's the issue of the responding to this with the budgeting process. And as you know, across the globe, CSO is the CSO mainly focusing on how government can work properly, that's monitoring and making accountable them. But we have seen in Bangladesh that's that as a CSO, we have been pushing government since March, and we have been inviting the different stakeholders, including the media, to identify that how much do you need for responding this COVID situation, and particularly as we are talking about the hand washing for 20 seconds. And so you can imagine that how much water do you need and how can we prepare for this water. So all together we need a lot of allocation, particularly for the poorest of the poor and marginalized. So that has been created a lot of evidence, and the CSO are trying to reach the government, particularly local government, that to allocate hygiene budget for the district and sub-district level, because most of the poorest and the marginalized are living over there. Because we have seen in one of the sub-district working with the partnership with Simabi, which is supported by the Ministry of Foreign Affairs in the Netherlands, that's during this COVID period, the mostly women and marginalized, they are not getting any message what is going on, how that has been creating impact on their life. And that's really initiated by this project, that we need to inform the community, we need to inform them how much they need and how they respond to this COVID, and engaging the radio movement and focusing on the basic needs of the water and sanitation, that the CSO make the government accountable by bringing the lot of evidence that how much they need for this COVID response. And you will be happy to know that during this month of June, government has allocated in their budget, national budget, only 10 billion euro. So, but now we need to see how that is going to spend. And you see, this is the in Bangladesh, the CSO is very much active in mobilizing the community, because the three things is important at this pandemic: the social distancing, hand washing, and face covering. So how that can be reached to the poorest of the poor? Now we are talking about, as at the beginning, the Honorable Assistant Secretary General of Human Rights, he has underscored the wash as a human rights. So how that can be translated at the ground, that is very important at this moment. So that's the and budget allocation is one of the important elements for making the government accountable, because this is the amount people don't know how it is coming and how much it is going. So that's the transparency and accountability issue is also important to see. So to reaching the unreached, that is very important. And at the ground, it is very much important to see. So as a rural community, we are working with the CSO. Thank you very much.
Yes, thank you so much, Robert. What a lot of the things that are emerging are, there are not necessarily very formal accountability mechanisms that do exist. And we heard earlier from the Assistant Secretary General around really creating that around human rights and what we're missing here. But even in places and settings where there are no formal accountability mechanisms, seeing the work that has been done with communities, how that has helped in creating a relationship or push that creates some of the accountability that we're looking for, or in the case of the experience of water aid, even how the relationship that is already established with government can help and facilitate that. And even also, as Barbara was talking about, some of the blind spots that we may see, even as we look at accountability mechanisms, to make sure that we pay attention to that. And the last speaker, panelist formally here, and I'm gonna come back to you for questions as well. I see that people are inserting questions, is Alejandro Jimenez, who's the Director of Water and Sanitation at SWA. Alejandro leads the coordination of UNDP Global Programs, Goal and WASH, and he's a specialist at CU for water, sanitation, and hygiene. Alejandro, are you there? I can't see you.
Yes, I'm here. Can't you see me?
Great. Yes, yes, now I can see you. And specifically to you, Alejandro, you've heard some of what the others have said. Can you point us to what you see are some of the opportunities that you see are out there? We've talked about some of the things that have been done. Earlier, Barbara talked about the challenges, Dido and Zubair talked about some of the things that they've been able to do or they've been able to see. What do you think are maybe one or two missing challenges, and especially focus on what the opportunities that you see in this space to be able to really get accountability right at this time and the opportunity that we have of this moment? Over.
Okay, thank you. Thank you very much. Well, I think there are a couple of things that stand out. First is that the governments and general stakeholders have been doing a very big effort to provide services to everyone, right? It perhaps not, I mean, it has not been successful 100%, but certainly there is a lot of effort going on, and the examples of shared in the first panel really show that. But then these efforts are not only in terms of providing service, but also in putting information out there. And actually, we have seen with the lockdown and so on, a lot of channels of communication, radio messages, all other kind of things, social media, etc. And that has been used in terms, mostly in terms of issues related to the pandemic, to wash your hands, to IPC messages. That's all great, but there is an opportunity there to continue sending information to the population related to more accountability issues. What has been now mentioned, okay, there is budget allocated, how it is going to be used, how is it being used? So actually what we have seen is that there has been an effort in putting information out there, not so much in terms of explain and justify, which is a key dimension of accountability, but just to say that this could be used. And there are very good platforms set up, particularly by ministries of health, but also coordination mechanisms at the country level to put information out there for the population that could be used for accountability mechanism. So I think that is where we have a big opportunity, and that relates not only to the governments, it relates also to the regulators who have been doing a great job in many places, and we have seen a couple of examples in the first panel. The service providers are also trying to put out information, online mechanisms with the consumers and all that. So I think that is where we could really push to maintain this flow of information and to move it towards accountability. And I think the civil society organizations play a key role there in trying to make that additional push. And we have seen a couple of examples now that have been mentioned by the previous participants. But I want to raise a challenge as well, and a challenge that is not easy to solve in the short run, and also with the limitations of access to information that have been already shared by, for example, by UNICEF, is that the most vulnerable are typically outside the formal mechanisms of subsidy. So governments are making extraordinary efforts, yes, but then how will the money reach those that don't have documents, that are not legalized, that don't have a water bill to pay? You can't, if you don't have an invoice to pay, then that doesn't matter to you because you are not connected to the formal service provider, and you still have to rely on informality for your services. So how are we reaching these people? It is, for me, our greatest challenge ahead. Over to you.
Thank you very much, Alejandro, for that. One of the things that jumps out at me is, and somebody did put this in the chat as well, you mentioned it, some of the people that really don't have access are not identified, are not identifiable, don't have an address, or maybe not even be connected to this. And somebody did put in the chat also that COVID found some districts that were unprepared. So we're obviously no country with all of the government effort is one block, right? Some of them are harder to reach. Some of them, in terms of putting in the basic systems, in terms of also devolution in many countries, how do they respond to that? And I don't want to address this particularly to anyone, but does any one of you want to touch on that point and saying, how do we support district, or have you in your work had to step in and work with local government or districts that were not necessarily prepared in the way that the national government, or at the speed of a national government?
While the others come in, just to say that we have seen that beyond the big cities is where the measures are taking more time to materialize. So smaller municipalities, rural areas, and so on. So now I'll give word to the others with concrete examples, but we have seen that in our global mapping. Thank you.
Yeah, and I know Zubair wanted to step in.
Yeah. No, I think the local government, the district and sub-district level, they are always deprived, and they have some kind of gap from the national government allocation, and that's why it's had been a lot of misunderstanding or confusion that how much they are allocating or receiving from the national government, but according to the commitment, how much they are able to reach to the unreached. One point that I would like to underscore, that this is the right time to underline that who are the left behind, because we are talking many things since the new SDG arena has arrived, but we are not able to identify that who are the left behind. I think this is the right time to identify the who are the left behind and reaching to them, because we are not reaching to the poorest of the poor and marginalized yet. Kelly was saying the data issue. That's very important to identify the real poorest of the poor and reaching to them, and relate them with the government commitment. Accountability is not jumping in any way. Some kind of movement and ensurity is important. Alexandra already mentioning that how we can reach through the media, that's fine, but that is the input level. But what are how poorest are receiving? Because it's we are counting many things in the sky, but at least we have to identify them. Thank you very much.
Thank you. I know we do have to wrap up, but I know that Barbara wants to step in and maybe just let you do that. And then if Dedo, you have just 30 seconds. I know we're already running out of time. So if you, Barbara, over to you.
I'll try and be short, Valerie. I just wanted to refer to the South African context where national government actually put in a program to try and deliver emergency water supplies to the unserved, which was very much around rural areas, but also primarily around informal settlements. So if we're talking about the left behind, that's who was identified. And there was a national program of delivery, which was coordinated through a national command center. But it does raise, once again, the sustainability issues of who takes over long-term the functioning of those services that have now been delivered nationally in what is actually local government function. And so that remains as a challenge. Just to say that there was another interesting example from the South African case, which was that the Auditor General of South Africa actually proactively put in place an engagement with civil society organizations to say to them, please tell us what is going on around the water delivery so that we can actually know if there's issues that we should be engaging with even proactively here, which was an interesting kind of proactive accountability approach from the Auditor General.
Absolutely. Thank you so much. I'm getting signs that we do have to wrap up, and I do want to appreciate all of that. And Barbara, thank you for taking us through a full circle, getting us back to this sustainability approach that we need to have to the intervention and to the accountability. And I do wish that we did have time to go back to some of the government representatives that are on the call to have an exchange, but this has been really, really great in terms of learning from not only what is happening, but also hearing both sides of the coin of groups that are on the ground and that are doing this. And again, as Alejandro said, governments have been doing such an amazing job in trying to push this agenda. And on that note, I do want to thank all four of you. It's been great. It's been short, but thank you so much for sharing your knowledge, your expertise, your experience with us. And I will hand over back as we're on time to Katarina. Thank you.
Thank you so much, Valerie, and congratulations for a great job. And let me be also quick for us to try to finish on time. So just to finalize, thank you for everyone who participated to discuss about accountability. And if there is something that we learned today or that we reconfirmed today, is that we need accountability if we want to make SDG 6 work, and if we want to make sure that the human rights to water and sanitation that were explicitly recognized 10 years ago become a reality for all. And so accountability is a fundamental human rights principle. It's one of SWA's guiding principles, and because we want to make sure that accountability stays at the heart of the work that everyone among our partners does, we developed the mutual accountability mechanism that I already referred before. And why? Because even though we find that state-led accountability mechanisms are important, and as the ASG said, we need more avenues for addressing rights violations, and these state-centered mechanisms do have gaps. So we need to improve the systems of accountability that exist at the national, regional, and global levels. At the national level, whether regulatory frameworks or complaint procedures before the Defensorías del Pueblo, ombudsman offices, etc., anti-corruption measures, or even legal processes. And we need to improve them all. And in different areas of work, we are here talking about water and sanitation, but some of you have talked about health and about nutrition and gender and discrimination against minorities. And let's also add aid effectiveness and development and human rights in general. People who have been marginalized or disadvantaged are entitled to services as human rights. So we need, as many of you have said, to use this time of COVID that has rightly drawn the world's attention to the plight of people living without access to basic services, to change the way that we work and to ensure that accountability counts for everyone wherever they live. And we think that through SWA, we all have a chance to do that. I'm not saying that we are the only mechanism, but we also provide all with support, and hence we are asking our partners to engage in a process of commitment making and commitment reviewing within our mutual accountability mechanism. Listening to all of you, I leave this short, I agree, Valerie, discussion inspired about the possibilities of the things that we can do together. As you saw, for example, at the Universal Periodic Review at the United Nations is not paying attention to water and sanitation. Is there a way for all of us to engage with the UPR? And from our side, from the Secretariat side, we are willing to do that. But from your side also, in order to make sure that we have the reports from the UPR also addressing water, sanitation, and hygiene. And there are many more examples that we learned from, and we will prepare a short summary of this discussion that we will share with partners. A lot of governments are reviewing national plans and budgets, and we would like our partners under the leadership of governments to use this opportunity and capitalize on it to make meaningful commitments, and I'm again talking about our mutual accountability mechanism, that focus on, and I will mention three: prioritizing WASH as part of the response and thus allocating more resources for it. 2, prioritize any resources towards reaching the furthest behind first. And number 3, build on each other's commitments and make sure that all investments are sustainable and inclusive. This cycle of commitments with a COVID response can be a cycle of mutual accountability at country level, at global level, through our upcoming finance ministers meetings, and we will have 3 of them this year, regional, between mid-October and mid-November, but also our sector ministers meeting at the end of 2021. Each one of us has a part to play, and we must be prepared to stand up, be counted for our actions. And I encourage you all to join us and work towards a more accountable world and a more accountable sector. Thank you so much for your participation and for your engagement, and stay safe, and hope to hear you and see you again soon. Thank you.